teach you about the squamous cell carcinoma. Squamous cell carcinoma is the most common tumor. These factors of developing squamous cell carcinoma are exposure to UV radiation, xeroderma pigmentosum, and TP53 mutations. Now moving towards the morphology, it is basically non-invasive and invasive. In non-invasive, it means that the cancer is not invaded through dermoepidermal junctions. It is sharply defined and appears as red scaly plaques. Okay, and invasive lesions, we see keratin production, keratin pearls, and ulceration. Means if it is non-invasive, we see grossly as a sharply defined or red scaly plaque, and if it is invasive, we see keratin production and ulceration grossly, and keratin production in microscopy. So what are the precursor lesions? The precursor lesions in case of squamous cell carcinoma are squamous cell carcinoma in situ, that is also called the Bowen's disease, and actinic keratosis. Now, what is difference between the squamous cell carcinoma in situ, that is Bowen disease, and actinic keratosis? These are the precursor lesions of the squamous cell carcinoma, and they are non-invasive. And there are few differences between the squamous cell carcinoma in situ and actinic keratosis. What are these? These are that the difference between the actinic keratosis and squamous cell carcinoma in situ is that the atypical cells in squamous cell carcinoma in situ are present in all the layers. It means we have atypia. If we have atypia in all the layers, then it is we called it as squamous cell carcinoma in situ and Bowen's disease. Okay, and in actinic keratosis, we don't have atypia in all the layers. Okay, and now these are the non-invasive type. These are the precursor lesions of the squamous cell carcinoma. And if the squamous cell carcinoma has invasion, then we call it invasive squamous cell carcinoma. And in invasive squamous cell carcinoma, we see the polygonal cells, we see the large areas of keratinizations, and we see the keratin pearls. What are the keratin pearls? Keratin pearls basically are having central keratin, and they are surrounded by the squamous cells. And the immature, we also see the immature keratinization. What is immature keratinization? It is called abortive single cell keratinization, means the keratinization is not completed. Okay, this is all about squamous cell carcinoma, and I will show you the picture of it or microscopy of it. Okay, here you can see the keratin pearls. These are the keratin pearls. The round ones are the keratin pearls, and here we can see the keratinization, intracellular bridges, and abundant eosinophilic cytoplasm. This is the squamous cell carcinoma.